part 4 of Mental Health Through Will Training by Abraham A. Lowe. Muscles and Mental Health. A panel discussion conducted by patients. Frank, panel leader. I will start off with an example. When I first came to recovery, I had so many symptoms, I did not know where to start first. My symptoms were all pretty strong, and I did not know which was the weakest. My main symptom was nervous fatigue. Today I know it is not muscular fatigue, but merely a sense of being tired. At that time, I had difficulty sleeping. It took me anywhere from an hour to 3 hours to get to sleep, and after I got to sleep, I would wake up every hour or so. And this went on practically every night. I also had practically no appetite and had to force myself to eat. I also had blurring of vision, numbness of the arms and legs, and pressure in the head. A noise in the ears bothered me a lot. On top of it, I had difficulty making up my mind, and the simplest decision gave me trouble. Finally, I had to give up my job and did not work for 4 years before I joined recovery. Even after I came to recovery, it looked like a pretty hopeless job. Then I remember our doctor once saying in class that it is the minor symptoms that must be worked out first. But I couldn't tell a minor symptom when I saw one. Today I know that it is not so much the weakest symptom that must be handled, but the simplest method that must be used. And the simplest method is control of muscles. Ever since I used my muscles to walk on, fatigue or no fatigue, I am no longer troubled with that awful tiredness. And since I have been using my muscles not to toss in bed, I have no trouble sleeping. Harriet. Every now and then, when I'm talking with new patients, they are surprised when I tell them that I was pretty sick for over 15 years and am well now. They think, maybe you're not as sick as I am. Of course, everyone thinks they're the sickest person in the world, but I think I was very sick all the time before I came to recovery. I can remember in high school, I got my famous headaches and nausea and fatigue and dizzy spells and weak spells and palpitations, and my ears ached and my eyes blurred and my throat choked. And I would go to the doctor and he would prescribe a tonic or say I needed a rest, and then maybe I'd feel better for a short while, and then another series of symptoms would come along. Each time the new series would come, they would be intensified until about 6 years ago they got so bad I decided to quit work. For the next 2 years, I went around to doctors and clinics and had all sorts of x rays taken and all kinds of medicine prescribed. But the trouble kept getting worse. So after I had gone all around to every place and even went to consult a doctor in Montana, I talked again to the family physician, and he recommended I should go to Chicago and consult our doctor who, my family physician said, treated his patients with a new method. He meant the classes and recovery. Well, 3 weeks after I came to Chicago, I was working part-time. After 4 months, I worked full-time and have been working ever since, that is, over 4 years. I can say I feel better than I ever felt in my life, and no amount of money could ever pay for what I learned in recovery. Frank, can you say that you attacked your symptoms at their weakest point? Harriet, I don't know that, but the doctor told me to use my muscles. So I forced myself to eat when I felt nauseated, and forced myself to walk when I felt exhausted. It wasn't easy, but what helped me was that I accepted the authoritative knowledge of our doctor. I know our doctor would not ask me to do these things if they could do harm. Christine, my main trouble was a terrific feeling of depression and fatigue, which I thought was the hardest thing to overcome. When I got up in the morning, I thought I could hardly move and needed rest. But soon I learned the muscles could be commanded to move, but that didn't work the first few times. I had to practice a number of mornings, and what helped me most was the example of other patients when they were interviewed in classes. I thought, what they can do, I should certainly be able to do too. And so I said to myself in the morning, you certainly can make your hands and feet work. What helped me was, like with Harriet, that I accepted the doctor's authoritative knowledge that my fatigue was in the mind and not in the muscles. My mildest symptoms, I think, was that I had to force myself to eat. When I felt my throat was dry and I couldn't swallow a bite, I remembered that muscles can be commanded to work and kept on eating. So I think I probably worked on the mildest symptom by the method which to me was the easiest to use. In the further course of the panel, Phil recounted how he suffered from a lack of self confidence after leaving the hospital, how he was afraid he made too many mistakes. If I would get a wrong number on the telephone or forgot to pick up a pencil I thought was going or forgot to pick up a pencil, I thought I was going back to the psychopathic hospital. As a consequence, he kept out of the way of people and experienced great hesitancy doing simple jobs. Finally, he learned he could always command the muscles no matter how weak the mind is. He then reported a recent experience. He was driving his car and on stopping threw the door shut, leaving the ignition key inside. When some time later he reached into his pocket, he missed the key and knew he had left it in the car. He felt embarrassed. He knew he would have to phone his brother to ask for the reserve key. But then he would have to admit I made a mistake and would have to look foolish. In former days, he would have thought of calling towing service and to have the car pulled in and would have considered some other foolish move, trying by every desperate means to cover up his inadequacy. This time he simply forced himself to use his muscles, call his brother, get the reserve key, and didn't feel embarrassed at all. Muscles and mental health. Physicians' comments on the panel discussion. When Harriet told recent members of recovery that she recovered her health after 15 years of a futile search for a remedy, she met with skepticism. Had she told the doubters that her main means of recapturing her health was to use the use of her muscles, their skepticism would have turned into outright cynicism. That the mind governs muscles is a truism accepted even by the most sophisticated mentality, but that muscles can be made to mold and influence mental activity sounds incredible to the skeptic and laughable to the cynic. Fortunately, our patients do not belong to the group of advanced thinkers and and to their plain common sense and unpolished way of viewing things, the humble muscle commands as much dignity as the pretentious brain cell. They know that if in a nervous ailment, central management breaks down the peripheral rank and file may be ready. The, the peripheral rank and file may be ready and can be trained to take over. And so, when in the lives of Harriet, Frank, Christine, and Phil, many hundreds of recovery members, the machinery of central management was thrown out of gear. The muscles were trained to hold the line until management could be reorganized and revitalized. After the muscles had demonstrated their ability to keep the concern going, the self confidence of the brain was restored, and the body regained its capacity for concerted action and balanced adjustment. To the skeptic, such hitting of the muscles for the brain may sound incredible, and to the cynic it may appear laughable. But skepticism and cynicism are offshoots of intellectualism, and recovery stands for realism, plain common sense, and an unspoiled way of viewing life. At the time when Harriet joined recovery, she suffered from a condition in which her brain had almost ceased giving directions to the muscles. If any guidance was supplied, it was in the form of fearful anticipations, gloomy misgivings, and dismal threats. The brain had retreated from active management of the body. It cowered away in abject defeatism, shivered at the thought of giving orders, and trembled at the prospect of having to take the initiative and to shoulder responsibility. There were tasked, tasks to be finished, decisions to be made, and actions to be planned, but the brain, paralyzed by fear, terrified the muscles into helpless inactivity and the inner organs of chaotic functioning. Harriet was tortured by headaches and nausea, and her fatigue and dizzy spells by weak spells and palpitations. Her ears ached, and her eyes blurred, and her throat choked. And for a solid year, Her brain warned her not to walk when she felt dizzy, not to work when she felt fatigued, not to eat when she experienced her nausea. The sense of hopelessness in the brain created an attitude of helplessness in the muscles. Action was held in abeyance. Life was suspended. After 15 years of unrelieved agony, Harriet learned in recovery that if the brain defaulted on its managerial duties, the muscles can be made to take over and to pinch hit for that cringing cerebral manager. At first, she had her doubts. The method seemed too simple. When her nervous fatigue made her feel exhausted and her brain threatened that the next step meant unfailing collapse, how was she to force her muscles to venture into that next step that might lead to destruction? But then she heard a patient recite in a class interview how she had routed her fears by commanding the muscles to do what they dreaded to do. That patient had developed the habit of growing panicky at the mere sight of a knife, fearing to do harm to the baby. During the interview, I urged the patient to practice touching knives and assuring her that the mere act of contacting or handling the dangerous object was certain to convince the jittering brain that there was no reason for jitters. The resoluteness of the muscles would conquer the defeatism of the brain. The patient accepted my suggestion. Practice touching knives and purge the brain of its fears. I would have never believed, the patient exclaimed, that such a simple method could cure my fears, but it did. Other patients reported similar experiences. One of them was afraid of crossing the street. Stepping out of the house meant to set going a chain of frightening symptoms: palpitations, sweats, dizziness, muscular weakness, and dimness of vision. The brain sounded the customary alarm, warning of a dire emergency. After due instruction, the patient learned to brave the empty threat of the sensations and the defeatist babble of the brain. He compelled his muscles to walk on and convinced his cowardly cerebral manager that no danger existed and that the warning signals flashed by the brain cells were false alarms not to be taken seriously. After Harriet witnessed several class demonstrations of this kind, she decided to give the method a fair trial, with the result that she worked part-time after 3 weeks of practicing muscle control and engaged in full-time activity after another 4 months. The brain had been convinced by the muscles that all that was required to shake off nervous fears was to make the muscles do what the brain feared to do. That the brain receives the greater part of its knowledge from the muscles ought to be plain to anyone who is not blinded by the glamour of fanciful theories. Knowledge means experience, and the bulk of our experience stems from our actions, and our actions are carried out by our muscles mainly. I do not wish to deny that a great deal of experience is gathered from vision and hearing and touch and smell and taste. But the type of knowledge secured from these sources is chiefly informative. Practical knowledge, the knowledge of how to behave, of what to do at a certain time in a given situation, comes to you from acting and practicing, that is, from the activity of your muscles. With regard to the variety of knowledge and experience that tells you what to do and what not to do, there can be hardly any doubt that the muscles are preeminently the teachers and educators of the brain. It is true that after the brain has received from the muscles its education about things practical, it stores, analyzes, and codifies the items of knowledge which it has acquired. It sorts them according to their importance and value, their harmfulness and innocence, their promise and success, and threat of failure. It formulates rules and standards and elaborates an imposing system of logic and wisdom for the sound guidance of conduct. But the fundamental teaching and educating are done by the muscles. That a flame causes a burning pain, the child learns after the muscles have touched the burning object. Once the pain and burn have been experienced through muscular action, the brain forms the rule that the finger must be kept at a safe distance from a flame. The relationship is clear. Muscles teach the brain, and the brain, enriched by knowledge, guides the muscles. Before Harriet fell victim to a nervous ailment, her brain had acquired a generous store of useful knowledge from the countless muscular activities of behavior which she had practiced in a busy childhood and active adolescence. From these endless series of muscular reactions, her brain derived a set of rules, principles, and policies which regulated her daily activity. One rule was that headaches, nausea, dizziness, palpitations, and the symptoms of similar kind are average happenings, not calling for emergency reactions. Another rule was that if doubts arose as to whether any of these symptoms were on were of an average or emergency character, a physician possessed of authoritative knowledge should be consulted. The third rule, we may assume, was that the dictum of freely chosen physician was to be accepted as sound guide for thinking about and acting on the inner experience. These rules had served Harriet well. They told her what to worry about and what to ignore, and they settled her opinions, beliefs, and convictions about health. But after she developed her nervous incapacity, she forgot the previously well established rules, indulged in self diagnosis, and produced sustained fears, panics, and vicious cycles. Eating, sleeping, walking, conversing were now considered as acts fraught with danger. The brain was crammed with ideas of threatening collapse and impending disaster. All her opinions, beliefs, and convictions gained from previous muscular behavior were drenched in a flood of defeatism. Fear ideas and emergency impulses poured forth from an intimidated brain down to the leaderless muscles, and action turned into inactivity, initiative into paralysis of will, self confidence into helplessness and hopelessness. When, after 15 years of agonizing existence, Harriet decided to consult me, my problem was to convince her brain that eating could be done in spite of the threat of nausea, that nocturnal restlessness and brainstorms were no bar to normal performance, that brisk walking was perfectly compatible with nervous exhaustion, and that a lump in the throat was no impediment to well articulated speech to or to resolute swallowing. It was not at that time that commanding the muscles was prescribed as It was at that time that commanding the muscles was prescribed as a proper remedy. As was mentioned, Harriet was at first skeptical, but when in classes and at recovery meetings, her skepticism melted. She commanded her muscles to lie quietly in bed when she was tense and restless, to walk on when she felt exhausted, to eat when the mere sight of food produced nausea, and to speak forcefully when the throat felt choked. And after the muscles swung into action, disregarding the symptomatic idiom of the organs, Harriet's brain was instantly convinced that exhausted muscles can do a fine piece of walking, that a weary body can lie motionless in bed until sleep supervenes, that a stomach harried by prospect of nausea can be made to take in food without sending it back, and that a throat drained of its moisture and contracted to a pinpoint could be induced to voice a well modulated speech. With continued practice of systematic muscle training, the brain finally was rid of its defeatism and invigorated by a newly gained conviction, mustered the courage to resume leadership and to reinstate the ancient set of rules, policies, and principles for healthy conduct. Harriet's muscles had re educated her brain. Had Harriet retained her skepticism, she would have refrained from practicing muscle control, and defeatism would have nullified or retarded her cure. Unfortunately, too many patients persist in their skepticism, scorning the use of a method which appears too simple to promise results. One such patient recently tried to challenge my statements about the role of muscles in shaping conduct with the question, "But, doctor, I don't suffer from palpitations or dizziness or fatigue. My trouble is in an obsession. How can muscles cure an obsession?" The obsession from which the lady suffered was one of jealousy. The patient knew that her husband was a model of matrimonial loyalty, but could not shake off the thought that he was unfaithful. She was told, "I grant that yours is what is called an obsession, but if you ponder the meaning of the word, you will realize that what obsesses your brain is an idea. You know, you you know from experience the ideas come and go. How is it that you cannot get rid of your idea? How is it that it obsesses you and occupies your attention for all the time. The reason is that the actions of your muscles feed this idea and reinforce it incessantly, preventing it from leaving the brain as ideas ordinarily do. Command your muscles not to act on the obsession, and it will die in inanition. I don't know what that word means. What you do is to keep the thought of jealousy alive by means of your muscular action. You rummage in the pockets of your husband's clothes to find evidence of his philandering. When you arrive home, you search rooms, garret, and basement to discover telltale objects left by your unwelcome visitor. You spy on your husband's activities, telephone his office numbers of times to check in on his whereabouts, scrutinize his mail and notebooks, and keep a close watch on every one of his movements. When he arrives in the evening, you subject him to a relentless bombardment of quizzes, questions, and suspicions. All of this is done by your muscles. Every search, every act of watching, every sequence of questioning intensifies your tenseness and keeps your attention forcefully riveted on the obsessive idea. That idea would die a natural death within a short time, as ideas commonly do, if you permitted it to expire. But the action of your muscles keeps it alive, prolonging your suffering and refusing to let your brain find its normal equilibrium. The surest way to make the obsession depart from your brain is to command your muscles not to ask questions, not to telephone your husband's office, not to launch into endless searches of rooms, pockets, drawers, and notebooks. In your case, the muscles, if properly restrained, would not only re educate the brain, they would also give it the much needed breathing spell and would relieve it to the well nigh intolerable tenseness under which it is placed through the action of your muscles. I could quote numerous other examples illustrating the many uses to which the method of muscle control lends itself in its task of either convincing the brain that defiance of symptoms is possible and harmless, or relieving it of pressure caused by morbid preoccupation with disturbing ideas and impulses. But my time is up, and I shall close with this assurance that what Harriet did can be done by every nervous patient, and that the simplicity of the method which she used ought to not be ought to be no occasion for skeptical shrugs and cynical sneers. Precisely because the method is simple, it is prompt, effective, and convincing. Thank you. Please join me again for the next chapter soon.